Bien, bonjour. Hello. Kwai. Hello. I hope you're happy today. Yes, excellent. Alors, j'aimerais commencer par reconnaître que nous sommes ici rassemblés sur le territoire de la nation algonquine Anishinaabe et nous reconnaissons les peuples autochtones comme étant les gardiens du passé, du présent et du futur de cette terre. Et merci à tout le monde d'être ici présent aujourd'hui. Bienvenue dans la grande circonscription d'Ottawa-Vanier. Mon nom est Mona Fortier, je suis la députée d'Ottawa-Vanier et ça fait un grand plaisir d'être avec vous aujourd'hui pour vous accueillir ici pour marquer ce premier anniversaire du régime canadien de soins dentaires. Et évidemment, je suis heureuse de pouvoir être accompagnée du ministre de la Santé, Mark Holland, et le fait que le PDG et président de Willis College, M. Henry Devlin, est également ici avec nous pour célébrer. Thank you so much for hosting us here at the Willis College. Your dental programs are equipping skilled professionals to meet the growing demand for dental care access across Canada. With the flexible learning options and strong career support, Willis College is making a real difference in ensuring more Canadians get the oral health services they need to stay healthy. Le Collège Willis est une des 3 institutions académiques collégiales qui existent dans la région de la Capitale-Nationale. Alors, je veux aussi reconnaître que le Collège de la Cité qui l'offre en français, le Collège algonquin et on a également Willis College. Alors, c'est vraiment important d'avoir ces établissements qui offrent autant de programmes. And as I said earlier, today we're celebrating the first anniversary of the Canadian Dental Care Plan, one of the largest social programs in the country's history, and of course, a significant milestone for our Liberal government. In just 1 year, this program has provided essential dental care to individuals and families who need it most, and it has helped restore smiles, alleviate pain, and especially boost confidence. Since its launch, 1.2 million, I should say over 1.2 million Canadians have received care, and more than 3 million have been approved under this program. A success made possible by the participation of 90% of dental care providers nationwide. Furthermore, this program is also providing them financial relief, saving eligible Canadians on average $780 by covering a wide range of oral health care services. Vous savez, dans Ottawa-Vanier même, nous avons plus de 4817 résidents qui ont été approuvés et qui ont reçu des soins dentaires auxquels ils n'avaient pas accès auparavant. Et cela signifie qu'encore des milliers de personnes dans notre communauté peuvent maintenant mener une vie plus saine, plus confiante et de qualité. Et ce succès n'aurait pas été possible sans le dévouement des fournisseurs de santé bucco-dentaire qui prodiguent des soins aux patients dans tout le pays. We deeply appreciate their efforts and thank you all for being here to mark this important milestone. Cette année, vous savez, tout récemment, avec le ministre Holland et même le premier ministre, nous avons rencontré la clinique dentaire Kilry, qui fait toute une différence pour la communauté. Et lors de mes visites, j'ai rencontré plein de gens qui m'ont dit que c'était toute la différence que ça faisait dans leur vie. Alors, vous savez, l'énorme différence qu'il apporte dans le quotidien des Canadiens et Canadiennes, c'est vraiment ce régime des soins dentaires. Alors, ça me fait grand plaisir, and I'm looking forward to seeing the evolution of this program, and I'm hoping we're going to talk about that today, and how it will continue to make a difference in the lives of hardworking Canadians, because costs should never be a barrier to one's health. And I will now invite the CEO and president of Willis College, Henry Devlin, to the stage, which he is with me at this time, and welcoming the minister and all of you. Thank you.
Merci. Welcome, everyone. My name is Henry Devlin. I'm the president and CEO of Willis College. We are very excited to have the group here with us today to hear of this announcement and to understand what role we play in the bigger picture. As was earlier mentioned, over 3 million people have recently been approved and will be receiving dental care over the next several months. and years to come. What those dental offices are going to need are dental assistants and hygienists to help with those services. Willis College, the oldest regulated college in all of Canada with 158 years behind us, has trained hundreds of thousands of graduates for the nation's capital in this region. We are proud in an innovative school with our programs and how we look forward to sort of reaching a wider audience. In the last few years, not only have we delivered what we would call the traditional dental assisting program, but we've also launched a brand new program in the last year and a half, something we call DAD, which is our Dental Assistant Distant program. This allows us to train someone in any area of the country. You know, if we're looking at Ontario from Thunder Bay to Windsor to Cornwall and everything in between, you don't have to leave your community to be a Willis College student taking that training. So when you're a dentist in small communities and you're wondering, where am I going to find the staff? That staff could be working with you and living in the community with you right now. They can participate in the Willis program and they can become a dental assistant for you within a year. So we're excited to play our role. When the announcement was made about the CARE program that was going to be launched, not only were the services exciting for Canadians, but for us as a school, we understood that we could play a special role in that. So again, today, thank you all for being here, and I'm just very excited to see Willis's part in all of this. I'm now going to turn things over to Minister Holland. Thank you. Thank you so much.
Merci beaucoup, Henry. C'est un grand plaisir d'être ici. Merci beaucoup pour tout votre travail acharné. C'est remarquable. Et le collège, l'histoire du collège, c'est essentiel pour notre système bucco-dentaire partout du pays. C'est aussi fantastique d'être ici avec Mona, mon grand ami, mais aussi quelqu'un avec beaucoup de passion, de s'assurer que chaque personne partout au pays pour obtenir le soin qu'ils ont besoin. C'est absolument essentiel, ça. And today, we're really going to talk in three parts. So the first is a state of where we are, and we've got great news. And the second is what's coming in the next short while. And the third is to kind of talk a little bit about what's at stake in a broader overall sense. The first thing I have to say today, aujourd'hui, je peux dire que plus de 3 millions de Canadiens et Canadiennes sont inscrits dans le système bucco-dentaire canadien. Ça, c'est absolument remarquable. Et en plus de 6 mois, plus de 1,2 million de Canadiens ont reçu des soins partout au pays. It's actually a little higher than that. It's 1.25 million, if you can imagine that right now. And I feel like we just announced 1 million, and we're already at another 250,000. And it shows, just as Henry's talking, how essential this program is. It's remarkable for me to go everywhere in the country and to talk to people who are being touched. You know, just last week I had an opportunity to talk to the head of the Denturists Association. He's telling me, and this set the record for me, a senior who had the same pair of dentures for 64 years. Now, he took pictures. I mean, it's absolutely insane. There was almost nothing left in that poor woman's mouth. Every bite is pain, a smile that she wasn't proud of. Imagine what it means now she has a new pair of teeth in her mouth. Imagine what it means to her sense of confidence and dignity, and also to her health, because that's fundamentally what this is about. I'm also excited to say that we're now over 90% of providers in the country. And you remember, the Conservatives said that no one was going to sign up, no one was going to participate in this program. Over 90% of folks are. And in fact, in some jurisdictions, we're having to re-understand what 100% means because we're finding out providers we didn't even know were there. So in Manitoba, we're inches away from 100%. It's the #1 jurisdiction in the country. And I can tell you that Mona and I and our Prime Minister will not stop until every Canadian gets care. That 3 million that's are there today. It's just so powerful to hear the difference that it makes. And let me talk about it in a practical sense, because Henry, I really appreciated our conversation beforehand, because one of the things that I think was important to highlight today in the essential role that dental assistants play in this system, I talk to so many dentists who say, look, it's not the fact that there isn't a dentist in this community, it's that I need more support and how many more people I could see. And to hear how this program is invigorating colleges like yours, yours is the oldest college, and how you're innovating programs like the DAD program to make sure that you actually can connect to people who already live there. Why go and send somebody to a community if we can train them right in the community that they're in? And that's what this dental care program is doing. It's connecting people to care. And we're finding out just how desperately people need that care. And I'll put it in one anecdote, and this is a really powerful one to me. When I was talking to Dr. Redmond in Gander, he's in a rural and remote community there. In just 3 months, you could imagine his team found 3 oral cancers. That's just one clinic. And imagine that those oral cancers wouldn't have been found otherwise. Imagine how much it costs our health system for somebody to not get that cancer caught early, for them to wind up being incredibly sick and taking up incredible amounts of hospital time. Imagine what it means, my God, if they died. That's what this is about. It's about primary care. And the work that dental assistants do, that hygienists do, that dentists do, that denturists do, is essential health care. And I can't tell you how many dental assistants I talk to, or how many hygienists I talk to who say, you know what, because of this program, we were able to see somebody and we caught that problem early, right? There was an issue in their mouth or we took their blood pressure and found out that they were hypertensive, or we found out that they were on track to diabetes, and that conversation changed their life. And to get to work in a place like that, connecting people to care, to hear the joy. You know, it is the most incredible thing in my life to see people who've been so desperate for care finally getting it. You know, when we announced the 1 million, an individual came up to me and he said, you know, I years and years and years ago I went in and I need to get a tooth removed. It cost me $700. And anytime I had a pain in my mouth, I didn't go anywhere near a dental office because I couldn't afford it. And I was terrified of what it was going to mean to my family and I couldn't put that on my family. Now I have dental care. Now that isn't a problem. I walk into the office and I get the care that I need. So it's essential. Here we are, almost every conceivable senior who's eligible for this program is signed up. And now we've over 3 million Canadians. So a lot of folks are asking, where's the next cohort? When are you going for the rest of it, all the 9 million? First of all, it's a great problem to have. It's wonderful that so many people want to join this program, and it's emblematic of its success. But I'll tell you what we've done with this program every step of the way is make sure we get it right, that we do it iteratively and that we get each piece of it right. Right now we're doing predetermination. Now you might remember I've been saying for a while, predetermination and pre-authorization, which is sort of the more complicated dental conditions. We said this is going to be a heavy lift. This is a big thing to do. As Mona already said, this is the largest federal program ever rolled out. And so we want to make sure we get pre-authorization dead right before we expand to the other cohorts. And so I'm here to say in the first order that we have to get that done. But as soon as possible in the new year, we want this to expand to every Canadian everywhere in the country, because oral health is health. And we need to make sure that we put into the ground that never again in this country will somebody not be able to get oral health care because they can't afford it. Those days need to be in the rearview mirror, and we can never allow them to return. And so here I will talk a little bit, because I used to be in opposition, and I'm not going to get too much into it today, Henry, because this is not a partisan place. But I'm going to speak just for a second about the battle that's to come. Mm-hmm. We aren't in round one. And I can tell you that I'm spending every ounce of my energy, as the Prime Minister is and as Mona is, on making our health system better. We cannot afford the status quo. I cannot say this loud enough. If we do not move to a prevention-based system instead of a crisis-based illness system, it will crush our system. We have to change. And I'll tell you, dental assistants, dental hygienists, dentists, denturists, they understand this better than anybody. When you catch a problem early, you save boatloads of money, you save pain. That's the system that we need. We have to change the system that waits for people to get sick and then do something about it. And I'll tell you, it takes a Herculean amount of effort. But in just 6 months, as I said, over 1 million people. In under 8 months, 1.25 million. And we're going to make sure that everybody is connected to care, but it is only the beginning. We're going to be signing pharmacare agreements across the country that make sure that people are connected to essential medicines that they need. We're making huge moves on integrating our data system. And let me talk about that just for a minute. Europe is making sure that they're all coordinated, all moving the same direction on their data systems. If we don't do it in ours, they're going to run circles around us. Run absolute circles around us. Because when you have an interconnected data system, you are able to get all of those points of information about a person's health, to get them screened early, to catch the problems early, to make sure that you catch something before it becomes major. Technology like AI can not only identify things early, but also take huge workloads off of you. You know, we got students here doing an incredible job here at Willis College. We won't want you spending all your time on paperwork, right? So if we got fax machines and duplicative systems, you could be seeing people and helping people instead of wasting time on this bureaucratic nonsense. We got to fix that. That's why Bill 72 needs to get done. That's a connected care legislation. I don't know anybody who's even opposed to that legislation. Provinces are begging for it. It's sitting in Parliament, nothing's happening because there are partisan games being played there. Well, let me say to people, there will be a reckoning. There will be an opportunity to talk about politics. But right now, it's time to get things done. This Parliament was elected as a minority government to get things done and reach across the aisle. And if you can't find any good reason not to do that bill, if you can't even make any strong argument, not a single argument of why we shouldn't pass that bill, then let's do it tomorrow. Because we cannot wait. Because the costs to our health system are too great. And let me say, if the leader of the opposition thinks that he can slink into the next election and through it without a debate on health care, he's got something else coming. Because as I said, I haven't even begun to talk about the politics of this, and I'm really not going to get into it with any kind of great depth until we get to an election. But every inch that we're fighting to improve this healthcare system, I will stand and campaign and fight for it. Because I can tell you, I can see with total clarity what this health system can be. If we, with cooperation and working together, transform our system to make it prevention-based, then we could change everything in this country. That isn't just going to improve health outcomes. That's not just going to make people more healthy. It's going to save a boat ton of money. I don't care if you're on the right or you're on the left. It's just simply the right thing to do. And enough of the wasting time and debate. Let's get it done. And if we can agree, I had a great conversation last week with Adriana LaGrange. Adriana LaGrange and the Conservative government in Alberta, there's lots of things we disagree about. But we don't disagree about what we can do for our health system. We got to pull in the same direction. We can't afford to waste time on partisan nonsense. We know what to do. It's time to do it. We're doing it on dental. We're going to get it done on pharmacare. We're going to get it done on data. And we're going to get it done overall. And for Mona and I, it is the fight of our lives. It is the privilege of our lives to do it alongside of you. Not as a political battle, but a matter of existential need in our country for transformation. Thank you so much.
It exists.
What's that?
It exists.
Yes,
It's all real.
that's it. Well, and, you know, I mean, maybe, no, it does exist. Maybe I'll just end on this, right? I know I'm just going to, but it's, yes, I mean, it's more than just dental exists, right? This is huge what we're doing. And I want to thank everybody. The students you're coming into, this work you're doing is so essential, right? It's so incredible. You're changing people's lives. I thank you for it. But I also want to remember something. When we're talking about the GDP of this country, we must talk about economic growth. But shouldn't we at the same time also talk about health span, how long we live in this country in health? You know, we're number 2 in the G7, right? We're 1 year longer than France, 1 year longer than Italy. We're 2 years longer than the United Kingdom, 6 years longer than the United States. That's 6 years longer that people live in health in Canada. We can be the healthiest country in the world. We can be the country where we grow old in health and joy with our families. That should be absolutely at the top of our list along with economic productivity. My mom, and I talk about her all the time because I love her to death, 80 years old, she's tailgating at Bills games. She's still practicing as a psychotherapist, right? I want, for whatever it looks like at 80 years old, I want everybody in this country to be living in joy with their families and having the time of their lives in health and in joy, not in sickness and disease. Over 70% of chronic disease and illness can be prevented. We can do this, but we have to have the political will to drive it forward. And I know that you have it in your hearts and I have it in mine, as does Mona and our team. Thank you. So I think we're ready for questions. Yeah, I'll turn it over to Matt.
Welcome, everybody. Bienvenue à toutes et à tous. We will begin with questions in the room before taking questions from Zoom. Please state your name, media outlet, and to whom your question is directed. You will have the opportunity to ask one question with one follow-up. Nous commencerons par les questions dans la salle avant de prendre les questions sur le Zoom. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question.
Hey, Minister. Max Paris with CBC News. I'm just going to put this back in here because it's easier now. Anyway, I'll do it like this. So you mentioned that in the new year you're hoping to have you're hoping to have all Canadians on the who are eligible for it on the Canadian Dental Care Plan. Can you be more specific about times? About time?
Yeah, no, I appreciate the question. And I know, and this, again, is a great sign. There's such demand in this country for care. And so I know people are anxious, and I'm getting asked everywhere this question you're asking about when to expect the next cohorts. So I'll just maybe expand a little bit more on why we're taking the time, first of all. Pre-authorization is extremely important. And what we've done, as you've noticed by rolling out different cohorts, is we'll find, we got to fix this or we got to work on this, and we work with providers and we get that fixed. And we've really built a wonderful relationship with providers. And we really want to make sure that predetermination is working and effective and ready to roll out to the whole population. So we've really got to get that right, which means that, I'm not able to give exact timing, but what I can say is that that's moving very well, that there's a lot of things that we're working on. It's a heavy lift. We always knew it was going to be, but as early as possible in the new year, and that we are 100% committed to doing this at the earliest opportunity.
Okay, and you talk about cohorts as opposed to all Canadians who are eligible for it.
It's a better term. You should use you're doing better than me on that. I should use that. Yeah.
So when you talk about cohorts, what do you, like? So far, we have 3 cohorts. Seniors, kids under 18, and I forget what the third one is, but
Persons with disabilities. Yeah.
Exactly. And so, what cohorts are we talking about now?
Yeah, that's great. So right now, because I think you're right, I sometimes skip some steps because I get a little excited. So when right now we're dealing with folks who are 65 and older, 18 and under, and persons with disabilities, right? So that's who's eligible today. If you haven't had a chance to sign up. It's a wonderful program. But for folks who are between 18 and 65, that's who we're talking about. That's the remaining bulk. What's been fantastic, as I say, on seniors, which were the first, because today it's 1 year since we started registering people. It's not 1 year since we started delivering care. In that 1 year, we're now at 3 million. And if you look at seniors who were those first bunch of months, the only people we were focusing on, we almost have all seniors signed up. It's really incredible, and it really shows the demand for this program. So, we've been sort of moving it step by step along this journey, but it's that now 18 to 65 group that would be next.
So that's just one final cohort then?
That's it. That will cover the country, yes.
Obviously the biggest cohort though.
It is very significant, yeah. So it is the most significant cohort, which is one of the reasons why before we turn the lights on and start serving those people, we have to make sure that it's fully ready to metabolize them.
Okay, thank you.
We will now proceed to questions from journalists online with Zoom. Nous allons maintenant prendre des questions des journalistes sur le Zoom.
Thanks, Matt. If you're a journalist on the Zoom and wish to ask a question, please use the hand-raising function. Again, we ask that you limit yourself to one question and one follow-up, and please state to whom your question is directed. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. Encore une fois, merci de vous limiter à une question et un suivi et d'indiquer à qui vous posez votre question. Just give it a few moments here. Okay, we have no questions on Zoom, so that'll conclude today's news conference. Any additional questions can be directed to Media Relations at Health Canada. La conférence de presse est maintenant terminée. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des Relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.
Thank you so much, everybody. Really appreciate you doing this today. Wonderful to be here at Willis College. And maybe we could, take a picture and say hi to folks and for anybody who's interested. Yeah, thanks so much. This was fantastic. Yeah, it was great. Really great.
Thank you very much.